The condition I chose was an ACL tear, and the ACL is the anterior cruciate ligament, and it stops your tibia from moving too far forward on your femur, so it helps stabilize the knee joint. So it's just the ACL being torn. And signs of an ACL tear can be a sudden audible pop, swelling in the knee area, instability, pain, and reduced range of motion with knee flexion. So the common causes of the injury is sudden cutting and an improper landing where your foot lands on the ground and your knee twists into valgus. So it commonly happens if your ankle has a small range of motion when it comes to dorsiflexion, because your ankle can't dorsiflex much. So when you stop, if your body isn't able to decelerate your body fast enough, and your ankle can't go into any further dorsiflexion, your knee will start to cave in and cause lots of valgus force, and it'll twist. Your femur will twist on the tibia, which is stuck in place, and that'll tear the ACL. So how this affects the joint, the tibia can track forward on the femur without any ligament to help stabilize it or keep it in place. The only thing that will be keeping it in place is the hamstring and the gastrocnemius, because the gastrocnemius attaches from the tibia to the fibula to the femur, so that can help keep it back, and the hamstring is from the femur to the tibia, and that can help pull it back when there is no longer an ACL, but the overall stability won't be enough for you to continue to engage in strenuous activity. So if you want to return to sport, you're going to have to do an ACL reconstruction with a tendon graft, either from the patella tendon or the hamstring tendon. And so after you do the ACL reconstruction, for the early rehab, you'll have to reduce swelling and try to restore range of motion. And the middle stages of rehab, you'll have to work on strength and control, stability, coordination. And then the late stage is sport-specific training, which will be specific to whatever sport you play. And the middle stages should also include some sort of neuromuscular training to help increase the amount of motor units that your body allows the knee joint to use, because your body will try to protect that knee joint as much as possible, and it won't let you output a lot of motor units. So the overall strength in the knee will be far less than the uninjured side. So training your body to know that it's safe for it to produce some force, whether that be by isometrics or eccentric training, just some sort of way to let your brain know that it's safe to produce large amounts of strength at the knee joint. So some tests to figure out if you've torn your ACL is the Lachman's test, which is where you grab the thigh and the behind where the calf is to move the uh, tibia anteriorly on the femur. And if it's a loose end field and there's excessive motion there, it indicates an ACL tear. And then there's also the anterior drawer test, which is just pulling by the back of the calf with both hands and pulling forward and looking for the same things.